Hi, my name's Henry. I'm going to explain how to use an inhaler which will give you a single dose of your asthma medication. First of all, can I ask for your consent to demonstrate the procedure and show you the equipment you need to use with the inhaler?
Sure, that's fine.
Before I start, I'll just wash my hands. Okay. Now, I'll get you to sit in an upright position in this chair.
Okay,
I'll just check your full name and date of birth to confirm it's the same information that I have on your drug chart. I need to do that before I give you your asthma medication.
no problem. My full name is Jennifer Allison Lee. My date of birth is November 16th, 1998.
Thank you. Do you have any allergies?
No, I don't have any allergies.
Thanks for that. I'll get the inhaler ready for you to use now. The first thing to do is to remove the cover from the mouthpiece. Then I'll shake the inhaler for a few seconds to make sure the medication is mixed well. After that, I'll attach a spacer to the inhaler.
What's the spacer for?
The spacer makes it easier for you to breathe in all of the medication as a single breath. I'll just attach the inhaler into the end of the spacer for you. Now I'll explain how to use the inhaler and spacer. The first thing you need to do is to breathe out completely so you empty your lungs as much as you can. Then you'll put the spacer in your mouth, while you hold the inhaler to keep it steady. Make sure that you put your lips completely around the spacer to create a seal around it.
Okay, I'll try to breathe out now.
That's great. Now, tip your head back slightly. Inhale slowly and deeply through your mouth while you push down on the inhaler fully. Then, breathe in slowly for 2 to 5 seconds. Hold your breath for about 10 seconds. After that, you can take the inhaler away from your mouth and breathe out slowly through pursed lips.
Okay, I'll try.
Make sure that you wait for half a minute to a minute before the next dose. You've been prescribed 2 puffs of salbutamol every 4 hours to help with your breathing.
Okay, I understand. 2 puffs using the spacer every 4 hours.
That's right. Finally, after you've had the 2 puffs of your inhaler, make sure that you wash the spacer and let it dry well until the next time you use it.
Thanks for the instructions. I'll make sure I do everything you said to do.